the respected judges and listeners. My name is Zainab Saleh Rahman, and today I will be talking about the recent global pandemic disease known as COVID-19. We'll be discussing how to prevent getting infected by this virus and how to take precautions in order to protect you and the ones you love.
Yes. It's okay. Take it.
The coronavirus disease, also known as COVID-19, is an infectious disease that is caused by the SARS-CoV-2 virus and was identified on the 31st of December 2019 when World Health Organization officials were informed of a cluster cases of pneumonia of an unknown cause in the Hubei province of Wuhan, China. Since then, it has rapidly spread globally and has developed many new variants that affect the severity and contagiousness of the symptoms. The majority of those who contagious develop symptoms such as sore throat, colds, fevers, loss of taste and smell, and in more severe cases, breathing. The majority of symptoms are mostly mild, but prior illnesses such as chronic respiratory diseases and diabetes can worsen symptoms and even cause it to be deadly. Okay, this is a diagram showing a COVID-19 SARS-CoV-2 molecule, and it's a brief explanation of it, what exactly COVID-19. This was made by a company called Mestic. The second diagram over here was made by the World Health Organization, which explains majority of the symptoms of COVID, going from most common symptoms and the least common symptoms and the most severe symptoms. It is spread through someone carrying it in microscopic liquid particles that are transmitted through their mouth and nose when they breathe, cough, or sneeze. When they breathe, cough, or sneeze. Another diagram by the World Health Organization, which shows two ways that COVID can spread, as it says there, through droplet transmission and airborne transmission. It also compares the size of a COVID-19 particle to a human hair, and as you can see, the difference is huge. Why do we need to take precaution? Well, so far, COVID-19 has taken 165,000 lives in the UK alone. To break this down, the highest number of COVID deaths in the UK was on the 19th of January 2020, when 1,487 deaths were reported. By the end of 2020, 94,998 deaths were reported. By the end of 2021, 167,892 deaths were reported, a whopping 82,000 additional deaths. How can we help? Currently in the UK, there aren't any domestic rules or regulations Currently in the UK, there aren't any domestic rules or regulations to help ease the spread of COVID. However, there are many pieces of advice given from both the government and the World Health Organization to help diminish the spread of this outbreak. Ways you can help are by properly wearing masks, especially in enclosed places. Taking tests if you have COVID symptoms. Keeping a distance of 1 meter. Keeping a social distance of 1 meter. Even if from others, even if they don't look unwell. Properly ventilating rooms, or if possible, staying away from poorly ventilated areas. Using coughing into your your bent elbow or a tissue, and disposing of that tissue immediately. Using sanitizer that is 70% alcohol, or if possible, washing your hands regularly for maximum 20 seconds. And lastly, getting vaccinated as soon as possible. There are also pieces of advice for those who have already contracted COVID. We can stay at home and self-isolate for 10 days symptom onset, and for 3 days after symptoms cease. Disinfecting surfaces to get rid of any germs that are spread from COVID. Keeping ourselves informed and updated on the latest news about COVID using trusted sources such as the World Health Organization and your local health authorities. By taking these precautions, we help reduce the amount of lives that are lost. And help keep ourselves and others away from COVID and keeping ourselves safe. We help protect those who are vulnerable and those who are most prone to death. So to end, a quote by Dr. Tedros from the World Health Organization: "Be safe, be kind, and be smart."
Thank you very much. I think you did really well with the technology messing around. I think if there's any online education, but anyway, I've got some questions for you actually. I know.
Calm down, all right.
Yeah. It's also explained you're a very fair judge, so take into account all of that. So